So, getting back into vlogging after a long summer of experimenting and getting things done. So today I'm going to talk about the 6 key things that I've learned about delivering to care settings digitally. So let's get going. Number 1, find a great partner. I've had the pleasure of working with a care home called Milford House just outside Salisbury since I think May or maybe even late April. What's wonderful there is that the activities manager, the manager there and some of the other staff have really invested in giving me feedback and working with me to see what the next steps are. We've been through a series of different permutations of what I'm offering them, from video packages to combination video and Zoom, to combination physical objects and Zoom delivery, and then, well, I'll tell you where I get to on that by the end of this video. But it's been so important in finding something that genuinely works and genuinely meets the needs of the residents. So number 2, distance. There's a distancing problem. We all know what it feels like to have Zoom fatigue, but for people who are potentially feeling really isolated at the moment, that distancing effect that being on camera has is finding little steps to kind of chip that away is really important. So I started delivering with just video packages, reminiscence video, and the feedback is that some of the residents engaged with that. It was partly useful for activities managers in delivering their own sessions, but that kind of key in from a whole group of people wasn't there. Number 3, screen share. So this is about overcoming the distance again. So staring at me on a big screen with my voice coming out of speakers in a room pushed people away, I think. I wasn't getting to and fro, when I asked a question, people were reluctant to contribute. But as soon as I started varying what they could see, that changed it slightly. So sharing parts of our digital exhibitions, but more importantly, using the video content that other people in the museum have been creating over lockdown to add into my sessions. So using our backstage, behind the scenes tours, and the little snippet video object introductions that go with our Pick and Mix Instagram exhibition. And as soon as it was me talking, a little video, I also did some videos of me walking through the gallery that I was talking about, and that really, really changed things. Number 4, ask yourself, can you make it physical? We're all getting a little bit more comfortable with the guidance on what we can and can't do. And I found that care settings have been willing to take a handling box. There's some quarantining that has to happen. And then because I was working in partnership with Milford House, they worked with me on how we could organise the session, structure it so that it was COVID safe. The residents only held one object that they took out of the box themselves, and because we can't clean them. So they only had one object, and that actually gave something to the session, weirdly. I'd talk about an object, and then they would have to work out in the room who had that object. What that did is it meant that they had to look at each other instead of just look at me on the screen. And that was probably the most important thing in overcoming this kind of distancing effect that I've been talking about. They were having conversation amongst each other, and their relationships with each other are so important at the moment, not just their feeling that somebody from the outside world has come to spend time with them. Number 5, prep. Not for me, but enabling the care setting, the staff and the residents to do some prep. So that's where I am now. Milford House are away having a conversation using my reminiscence videos from the start of the process. So I haven't thrown those out, they are useful. So they used the Childhood and Toys reminiscence video that I made as a stimulus for a conversation, answering some questions that I've asked them about the toys they remember, the things they wish they could have had that they couldn't have, their favourite toy, the thing that they held the most close. So that sort of thing. They're having that session in advance. Then I'm taking them a handling box, and then we will have our session. So you're adding in things all along the way. What we hope that this brings, and what the activities managers feel it will bring, is that they will already have a set of things to talk about with me, and that will give another level to the session that will make it feel more akin to what we usually deliver. Museum engagement professionals are good at what they do. We know how to make those sessions feel comfortable, to build those relationships quickly, to make it feel like people are learning and sharing. And finding these little ways to make these digitally delivered sessions a little bit more like that is so important. Number 6, time. As I sort of alluded to there, ordinarily it might take me 2 sessions to start to develop that kind of like really chatty conversational relationship with a group of residents. It takes longer. So I would recommend that rather than getting your one digital session down the package and popping it out to as many care homes as you can, if you can, to set up a series of sessions with the same group. If we're thinking about well-being impacts, I think that's where we'll have the most meaning in the lives of the residents. All of the things I've talked about, us trusting them with a box, other people from the museums popping up on the videos, makes them feel connected to us, and you can build that over time. And I suppose the last thing is keep your energy up. It's exhausting delivering via Zoom, and everybody I've spoken to who's delivering sessions like this says the same thing. It's more tiring doing 1 hour on Zoom to a care setting than it would be for doing 1 hour to a room full of under 5s. That's what I've found, because you have to project your energy through the screen to keep people with you. But lastly, it's really enjoyable, and building the relationship up with the residents of that home has been wonderful. When I dropped the last box off there, just through the reception, I could see one of the people who'd taken part. "I've just seen you on the screen," she shouted, and her face lit up. And I know that when we can get back to meeting them and I can physically go to their care home, I've created a relationship there that hopefully we can build on in the future.